Hi class, this is Ryan Steinberg and I am here to talk to you about a structure that fascinates me. So after thinking about it, the structure that fascinates me the most is probably the skeletal system. The skeletal system really fascinates me because it's still considered a rigid organ. Um, Basically, what bones do is that they protect various organs of the body. They also produce red and white blood cells. They store minerals, provide structure and support for the body, and they also enable mobility. Most people wouldn't think of a bone as an organ, that it's living, but it really is. And I found that to be very fascinating throughout my studies. Um, I want to pay close mind to the structure called the mandible, just because I found it to be probably the most fascinating structure that I saw. Um, so there's a difference between the medical specialty and also the clinical specialty and the surgical specialty to treat the mandible. Um, the clinical specialty would be more of a TMJ specialist versus the surgical specialist, who would be more so the maxillofacial surgeon. And they can study different diseases that I saw online, such as Paget's disease, temporomandibular disorder, and also osteonecrosis disorder. So osteonecrosis of the jaw. So the anatomical structure of the mandible is that it is inferior to the frontal bone. It is also anterior to the parietal bone, and then it is superior to the sternum. So there's a couple of anatomical landmarks um, for the mandible. The limited structure is the labial vestibule, the retromolar pad. The supporting structure is the buccal shelf area, and then relief structure includes the mental foramen and the genial tubercles. Um, and the mandible is a bone that forms the lower part of the skull, along with the maxilla, and it forms the mouth structure. So basically, it supports the movement of the lower jaw, it opens and closes the mouth, and it also allows for food to be chewed. Um, it's a structure that ends up getting used each and every day, multiple times throughout the day. I'm using it to give this presentation, so I thought I'd take a closer look at it and present it to you guys.